It's worth noting that tinnitus symptoms have been on the rise during this past year of COVID-19 lockdowns and quarantines for many reasons. If you have tinnitus, have you found yourself saying, "I've lived with tinnitus for years, but recently it's been more bothersome"? The journal called Frontiers in Public Health published an article in November of 2020 that indicated some startling findings about how COVID isolations affected people's tinnitus. They found that 34% of people with tinnitus reported a worsening of that tinnitus throughout the pandemic shutdowns. Why would that be? The study found increased levels of anxiety, depression, and irritability from the pandemic, and since stress and anxiety can be some of the most significant triggers, it likely worsened tinnitus for that group. It also found 58% of those surveyed reported an increase in loneliness. Of those who reported increased loneliness, the majority also reported increased tinnitus. Some of the key strategies for getting your mind off your tinnitus is being distracted with other people, work, or activities, which was not as possible to do while observing the distancing, lockdowns, or quarantines. Also, tinnitus tends to fade into the background when there are lots of other sounds around, but if you're isolating in your home where it's quiet, there may not be as many natural sounds in the background to help you habituate to the tinnitus. It wasn't just the people who were affected by COVID-19 shutdowns who experienced increased tinnitus, however. The same study by Frontiers in Public Health published that 58% of people who reportedly actually had COVID also reported that COVID exacerbated their tinnitus. The reasons behind this are unknown at this point, as are a lot of factors about this mysterious virus. There are sure to be many more studies and articles published that may bring enlightenment to this subject. As you have seen, tinnitus is a very complex and nuanced topic and is different for each individual. If you are aware of tinnitus in any form, I would encourage you to start with a visit to an audiologist. Good hearing isn't just important as a way to reduce the awareness of tinnitus, but also for good cognitive health. But that's another story. If you'd like to reach out to us for more information, our phone number and website are on the screen. Here's to happy hearing.